If you look at the demographics and the epidemiology, less than 8% of all psoriasis occurs younger than 10 years old. The big blip is in adolescence, which is terrible, because can you imagine the 16-year-old going to the swimming pool and they're asking her to leave because she thinks she has something contagious? That's bad. That blew her day and affected her self-esteem. And so between 16 and about 28 is a high incidence, and also in the early 40s is another. When kids get it, teenagers get it, their parents are bringing them in. They're coming in pretty quick. So that's not an unusual population to be taken care of. And many times people have thought they had pityriasis rosea or fungus or something else, but they come in and the diagnosis is pretty easy to make. The other group is mostly in the mid-20s, 30s, 40s, where they just can't take it anymore. I mean, they live with it for a while. It's amazing how many people with severe psoriasis that I see that come in with 20, 30%. And that's really, really severe. I mean, I can consider severe psoriasis, it doesn't have to be 10% or more body surface area. If you have severe psoriasis of your scalp, that's severe. There's no way you're going to use topical therapy in there every night and get it and be compliant and get it clear. And that's like 3%. If you have it on your palms extensively, by definition, that's 2%. And if you're in sales, you shake someone's hands, you're in medical professions, sports, can't use them. If you have it on your feet and it's cracking and bleeding and painful and you can't walk, that's severe. People end up, I think, getting to their wits' end and letting it go very often for longer periods of time till ultimately either some referrals from dermatologists or a family member gets online. I hear that a lot. My wife went online. I found a friend who knew you. Kind of that word of mouth, internet, then dermatologic referral. When I was in residency program, we knew that the epidermis, the upper layer of the skin, was growing too quickly. Normal epidermis takes 28 days to grow. In psoriasis, it takes 4. So it's growing 7 times the rate of normal. Because of that, it's not maturing properly. And the protein known as keratohyalin filaments within the cells of the skin, because the upper layer of the skin, very upper layer, it's dead. And it matures to turn dead, so that stratum corneum, also known as the horny layer, protects us from the outside. In psoriasis, that stratum corneum is no longer normal. There's nuclei in it. The cells are not normal. They're thicker. And we thought it was just a hyperproliferation in the 80s and before that. In 1980, at the University of Pittsburgh, which is a leading transplant center, in one poor soul who had severe psoriasis that required a kidney transplant, went on cyclosporin, an immunomodulatory agent, to prevent kidney rejection, and the psoriasis went away. That started thinking that psoriasis at the very least had an immunologic component. It was not just a keratinocyte disease. And what has been found since then is that there are T cells, predominantly helper T cells. T cells are not the B cells. B cells are, so you have white blood cells, they could be T cells, B cells. B cells are the ones that produce antibodies. T cells don't produce antibodies. And there are billions of extra T cells in the dermis, the second layer of the skin, in psoriasis. These T cells produce molecules that are inducing the proliferation of the epidermis. These T cells are also found in the synovial fluid that induces psoriatic arthritis, and it's also associated with Crohn's disease and ulcerative colitis, as well as rheumatoid arthritis, ankylosing spondylitis, hidradenitis suppurativa, and the amount of T cells that produce specifically tumor necrosis factor, or IL-17, which are both pro-inflammatory molecules inducing the proliferation of the epidermis. The severity of the skin involvement is also proportional to the amount of these molecules in the blood that induces atherosclerosis, that increases heart attacks and strokes in these individuals.